Good morning, good afternoon, good evening. It's Kevin Coyne, Venture with the Venture Outfitter. Today, I am moving a little bit slow because I just got over COVID, and it's kind of interesting to talk about. That's what we're going to talk about today. And because I'm actually really low energy today. I was just telling everyone that's here in the core audience that that's part of the thing we're going to be talking about. Just going through the normal things. Welcome to the Venture Outfitter. Part of what today's call is going to be, it's going to be somewhat informal about just us sharing as a community some of the dealings of dealing with COVID. We thought that because Jello, my assistant, and I both had COVID, even though we're on the same week, even though we're 7,500 miles apart, it was kind of an interesting thing, and I thought it's affected a lot of other entrepreneurs that I know, and part of what we're going to do is just talk about that. And so, thank you to DualWorks for being our host and our sponsor of this program. I always appreciate what Linda at DualWorks does for our community. Let us know if you need a mailbox all the way up to a closed door office. We've got specials for you. Um, I'm not going to talk a lot about the Venture Outfitter Network and the community, but if you're not on the community site, you can get onto it for free by just letting us know that you're interested in getting involved in the community. And certainly anyone who's in the studio audience should already at least be in the community if you're not at the network level. So today is all about preparing for COVID as an entrepreneur. I'm going to, we really don't have a lot of slides or anything like that, but part of what I thought would be interesting is just to talk about that. In my experience this last week of having COVID, wasn't as bad as I thought it was, would be. But I got the double vaccine, I got the Moderna, and now I guess I've been instead of getting my booster shot, I got inoculated the old-fashioned way, which has been interesting. I'll tell you a little bit about what happened in my case and stuff like that. And then I thought that it'd just be great for us just to share, hey, here's some tips and tricks and stuff like that about how to avoid it. For me, given that I've traveled internationally, 3 big trips last year, one of them all the way to Europe and back, I didn't think I would actually get COVID. And I think because I had cedar allergies, or we call it cedar fever here in Austin, and it's funny, I'm actually having a little bit of difficulty just because I'm tired still from getting over it. So if I stumble through words, it's nothing new for most of you all that know me, but it feels a little bit harder to get through it and just talking and stuff like that. But the thing that happened was I didn't think I'd get COVID because of all the precautions I typically take. And when I did contact tracing, there's only one time in the last week that I'm like, that's probably where I picked up the infection. I kind of knew that something was going on Wednesday of last week, and then Thursday I was like, wow, I have to actually go take a nap because COVID I thought it was just the cedar fever initially. By Friday, it was really clear that I had something much worse, and that's when the sleeping began. And I slept, I think, about 80 hours in 5 days, about 20 hours a day. Now, that was my way of dealing with it, drinking lots of water. Um, I did get a test. I got the over the counter antigen test. The antigen test doesn't test for the antibodies. It's not a really expensive test. But if you get the test, it's 100 and it says that you have it. It's 100% accurate if it says that you have it. It doesn't necessarily have that level of degree if it says you don't have it. But that being said, I was 100% certain that I had COVID. And so I pretty much slept it through and all that sort of stuff. Now, I did a couple other things that I think helped. The one thing that I hadn't posted on social media yet that I'll tell you guys that I think was kind of interesting is um, after all that sleep, after 4 days of pretty much, and waking up kind of a zombie guy, I went down to Barton Springs and I hopped in the water, when it was 50 degrees outside. The water itself was 68 degrees, but it did provide a shock to the system that I actually think, and there's scientific evidence that says, scientific evidence that it's good for your immune system. it was quite a shock. It did help kind of reset things for me, and I did that as well. I really don't want to hog up the conversation today because typically I can carry a conversation, but the truth is, I'd like to hear from you guys. Some of the different things, and there's some different other things I'll share about what's there. I mentioned to David Potes, one of our entrepreneurs from Mexico, also had it, and then Jello. I mentioned my assistant. I told him I was going to put him on the spot. Typically, I don't put him on the spot, but I'd like him to actually weigh in as well. David, you want to, since you're now, it's in the rearview mirror for you. What happened? And tell us about your experience.
Sure. So I got COVID on October from 2020, actually. So it's almost a year and a half ago, and it was different from what I've been seeing people close to me and around getting probably the Omicron variant. So for me, it was kind of rough. It wasn't anything dangerous, or I mean, I didn't have to go to the hospital, but I did was how do you say in English? I was on my bed for 10 days, right? I lost like, I'm sorry, I'm on the metric system, so I don't know what it's in pounds, but I lost around 6 to 8 kilos in 1 week. I mean, I couldn't eat. I had high fever for all those days. It was pretty debilitating. I mean, at first, the first day I felt pretty cool, and I was like, I had meetings on the next day, and I was like, okay, I'm just gonna do my meetings remotely. And much like you can, I mean, I couldn't stand up from the bed. I couldn't even. I thought I was just gonna, sit on my bed and turn the camera off and tell you, I got COVID. I'm just gonna be here in the background, but not even that. I mean, it was I couldn't. I didn't have the energy to do anything practically. Um, so at first, I mean, those 10 days I was completely in bed. And the thing was that after that, it's pretty much like I'm guessing you're feeling right now. I mean, I was like, okay, I need to work, and I'm feeling kind of like okay. But at the same time, when you start to do your regular activities and just sitting down on the desk and trying to work, I found that both your energy and your mind concentration is not there. I mean, and sometimes you're just struggling to look for words, look for the try to tie ideas of what I'm trying to say or what I'm trying to do. So just really quickly, I mean, for the next, I think, week or 2 weeks, I mean, I just practically worked sometimes 3 or 4 hours a day. I mean, it was because I didn't have the energy for much more. I mean, I was work a little bit and then sleep. And also one of the things I saw was that I didn't have any muscle strength. It was that was one of the things I was most surprised, because it was really amazing how I couldn't even go up and down the stairs. I mean, my legs muscles felt like if I just did, I don't know, like 200 squats. I mean, my legs were shaking, and even though I was in bed, I mean, I still got up and take a shower and things like that, and I didn't feel like that. But then when I was okay to leave the room and go downstairs, and I started to walk downstairs, my legs started to shake, and I was like, "What is this?" Right. So that was more of
And
a
I guess I should say this because a lot of people won't necessarily know your background and stuff like that. I mean, David's a martial artist; he's in good shape, all that sort of stuff, and so yeah,
yeah,
quite an interesting experience. Now, this was before you were vaccinated, right? This is you actually had it before the vaccines
yes.
were even available.
Exactly. That was all before the vaccines were available. That was on October 2020, on the beginning. I think I got COVID on my birthday. I think that was it. That was a bad birthday gift.
Mm.
Um, and my birthday is on the last days of September, and I started to get the symptoms on October, the first days of October. Um, but yeah, like you said, I mean, I exercise regularly. Regularly, I do Brazilian Jiu-Jitsu and also strength and exercise. So I mean, I thought on one side that helped me just to be healthy and to not get anything, for it to not be worse. Um, but yeah, I struggle a lot with getting back to the point of where I was physically. And one of the things, talking to a doctor here in Monterrey, I mean, I'm pretty sure many of you already know this, but he was telling me that, COVID is more of a neurological disease more than a respiratory disease, right? Because a lot of the symptoms that it triggers, and not right now with Omicron, but with the other variants, for example, you're not really able to smell or to taste. That's something neurological. It's not more of
Yeah, I
a
think this is an important distinction for a lot of people that because initially, COVID was being positioned as it's just another cold. It's like getting the flu or another cold, but it's absolutely not, right? Say more about that.
Yeah, so I'm bringing this up because so it's been almost a year and a half, and sometimes I still wonder if the I'm sorry, how do you say, the consequences, or the I forgot the word in English. What I'm struggling with sometimes with my memory and things like that, because one of the things I used to brag a lot was that I have a great memory, and right now I find myself struggling to find words, trying to find not something that is very obvious. Right now I'm struggling with a little with my English, but that's normal. But more in me talking daily with my wife, or business in Spanish and things like that, I find myself struggling a little bit to find some words, or to. So I don't know. Sometimes I think that if this is part of the consequences of getting COVID or not. I don't know if that's something that I need
So
to.
maybe some signs of long haul kind of issues. It sounds like
Yeah,
it.
something like that. Physically, I think I'm okay. And in terms of, I didn't have any issues with my lungs. My oxygen was always on the top, and the oximeter always 98, 99%. So I was pretty good with that. So, but I don't know. That's one of the things I still think about it, that it could be kind of like a lingering issue with COVID. And
So
currently,
let's talk about those different things that you actually mentioned. So
yeah.
for me, I was I had now I naturally have a lot of food that's just around in the house and stuff like that, and so definitely had a lot of food. Had a blood oxygen meter. It's called a blood ox that David just mentioned as well. And that is one thing that if you're going through this, you'll want to have around, because a lot of times. Someone actually told me that there was a younger person, like in his 30s, that passed away quite unexpectedly with not visible underlying issues, where just was treating at home and everything was fine, and then all of a sudden everything's not. And part of the thing that we've been told to watch for is our blood oxygen level, right? That's one of the things that just David just mentioned. Vitamins and zinc. I was pounding vitamin C, vitamin D, zinc, selenium, which is not. There's other examples of things. What about yourself, David? What was your protocol for getting wrapping your way out of that?
So yeah, definitely the oximeter is something that's very important. And my perspective, for example, every day I had 98, 99% measurement in the oximeter. But at the same time, you still, at least for me, I need that reassurance that, in terms of what it was that people were targeting at the time as something important, is to always be okay with your blood oxygen levels, right? So also the doctor that was treating me remotely, he always asked for that, and that was the first thing that he asked for. And when I tell him the measurement, he always was like, okay, so you're good, you're doing good. Even though I had high fever, excruciating body pain, excruciating headaches. Worst headaches I ever suffered from. Not even your worst hangover is something close to that. So
That
so
actually that ties into something I might say. I had a little bit of alcohol last night, and I'm a lightweight right now. It was just like I was a total lightweight. That was one of the things that really surprised me. You never would have thought that after two drinks, I'm like, two drinks is not a lot for my body weight,
yeah.
right? But two drinks was a lot last night, and I actually the problem is I actually had more than just two drinks, but I remember having
it
two
felt that
drinks, and I'm
that,
like,
that two
wait,
drinks. Yeah.
what's up with this?
Now we know why you're a little
Yeah,
tired.
yeah, and I'm a little tired. Yeah, I know. Omar's gonna give me a hard time because yeah, I had to. I just after being feeling so closed in and all that sort of stuff. I mean, I had a few drinks and I was just like, and yeah, it I can definitely feel it in my body in a way that doesn't make sense, right? It says it doesn't make sense. This is not a cold. I mean, even though I think I actually had Omicron, and I don't know how to actually go, test after the fact and all that sort of stuff. And it's real hard to get a test here, other than what I did for the at home test, unless there was a great emergency. But what else, David? And yeah, go ahead.
Yeah, so I was also going to mention that, for example, as soon as I started to recover and my appetite started to grow back, just to give you a quick example, my wife used to make me, some chicken tacos, and I'm a, well, I eat pretty well. I mean, in terms of quantity, I eat a lot, and I just couldn't finish one taco. Just to give you an example, I mean, it was some. I mean, I just didn't have the appetite. I couldn't eat. And as soon as I recovered, I started to feel like I had a huge appetite. I couldn't fill up. So at first, my first reaction was like, okay, this is my body, gaining back the weight and going back to usual. But then talking to this doctor that I mentioned, a medical doctor, he told me that that was part of the neurological issues that were on the people were experiencing. That that feeling that your mind, your brain sends to your, I don't know, to your. I'm not a physician. I'm not a doctor. That signal that sends to your stomach, signaling that okay, you're full. That is not being triggered, for patients after on the first stages after COVID. So that was really interesting, and how to when we had this conversation, my thoughts and my approach to COVID definitely changed in terms of like, it being neurological. It has a completely different set of issues and approaches and angles to tackle that disease, and that's, I believe, one of the main reasons there's still a lot of not knowing what it is and not knowing how to, because how can we don't have, for example, I remember a lot on the past, I don't know if I call it pandemic or not, but with the influenza and here that started here in Mexico. I remember that time when it started to grow, when people were scared and everything, and then suddenly, I mean, I'm simplifying on this a lot, but it was like, okay, you know what? This medicine actually treats influenza with no problem. And I've been waiting for that moment, like, yeah, you can just take Tylenol and it will kill COVID, right? I've been waiting for that moment, but because now I'm understand that it's more of a neurological disease and it has a lot of complications with that, and it has a whole lot of I don't know, ways to approach it. It's something that I still believe that we are not yet learning how to deal with it. And I mean, just to close out, because I don't want to take the whole hour, we can continue to talk about this, is that currently what I've been seeing is that with Omicron, I mean, I'm sure this is what you guys are seeing, is that a lot of people are getting it, and it's starting to become a 5 to 6 day disease that you can manage somewhat lightly, right? My family got it this past weeks. My dad and my brothers, they're all okay. They're right now they're cooling negative, and I'm still a little bit on taking my precautions, because I don't know if there are any consequences. I mean, I know people that have got reinfected, but I don't want to take my chances in that sense, right? So I'm still a little right now. I'm a little bit isolated in my house, and doing the necessary, going out and stuff like that. But at the same time, and this is with no scientific evidence, just like you mentioned, Kevin, that you've been traveling and didn't get COVID. I don't know. I mean, I have both vaccines. I'm still missing my booster because I haven't completed the time frame. But I went to different parts in the U.S. in this past year, where there were places. And for example, when I went to Florida, people in Florida. I don't know if there's anybody from Florida, but it was I was surprised at how nobody was using face mask. It was like COVID didn't exist, right?
Right.
So I mean, when I came back, I was like, I told my wife, this almost certainly we're going to get COVID again. It's like we were places that were really, really crowded, and I don't see how we couldn't get COVID, and we didn't get it. And so I don't know if the antibodies are still there, because I did get COVID, a little bit. I don't want to say dangerously, but it was strong. So I don't know. Again, this is with no scientific evidence, just my experiences, my experience in uh, going to some places where you're like, I mean, there's no way people around me don't have COVID, or just in terms of percentage, right?
Yeah,
And
no, it's really interesting just from the standpoint of the different things. I mean, for the people that can't see the chat, there's a couple different things that came up in the chat um, that I'd like to weave into the conversation and just have you all voice those. Vladimir, you mentioned something in the chat about the Apple Watch. Share about that.
Yeah, actually, I'm using it because I'm getting out of COVID too. It's kind of funny because we have a custom for the end of the year, receiving the new year. We have dinner at midnight. So right after midnight, my fiance started with the chills, coughing, fever, and everything. And 3 days after, she tested positive. And 3 days after that, I tested positive. I just had minor symptoms like back pain and dry coughing, very, very small symptoms. But my father is 87 and my mother is 78. And they didn't want to get vaccinated, and they are infected. But my mother, he has diabetes. My father is very healthy, blood sugar, heart rate, everything is fine with him. But the symptoms were minor too. So they are fine. They are doing good. And yes, I was using my smartwatch to measure my oxygen levels in my blood. Yes, very useful.
Yeah, Kim
It's
Johnson
very
was
accurate.
asking
Sorry.
which version of the
Series 5 or later.
yeah, so Series 5 or later is what
Yeah.
you guys are saying. The iWatch
Yeah,
Series 5 or later.
and it's quite accurate because I have I bought on the pharmacy a little one that you use on the finger, so it was almost the same on the levels.
I just actually ordered the Oura ring.
Oh yeah, that's
Yeah, I read that so far is the closest reading of blood oxygen because of the way the light cells or the light like bounces off your blood cells, and
Right.
being that it's around your finger, there's something about its like accuracy compared to like the way the Apple Watch is doing it now through this thicker layer of like skin and everything.
Yeah, here
Um,
versus
yeah.
here.
So
Mhm.
I mean, I just got it. I got the sizing, and they're supposed to be sending it to me.
you
And I
have
don't know.
you got the version 3, right? Series 3 is right now.
The Oura ring,
Then yeah, the new model
Yeah.
is
the
version 3.
latest one, whatever the latest one is now. Yeah, yeah. So I've been using the Apple Watch, I guess, since the Series 5, and I'm happy with it. But I wouldn't say that I'm like actively measuring, kind of on a regular cadence, all of my health kind of metrics. Um, but I definitely use it a lot for like fitness and things like that. So I mean, it's tracking for me things. I don't use it while I'm sleeping, so I don't know how it tracks your sleep if you're not wearing it while you're sleeping.
Yeah.
And the Oura ring, at least you can wear it while you're sleeping. It's not going to bother you as much, or the charging and battery life is not as much of a factor. So I'll let you guys know how it goes.
Yeah, you can
Yeah,
measure. It measures all the your sleeping phases, so you can know how much time you're sleeping and each phase and
Yeah,
the REM sleep and everything. Yeah.
yeah.
Well, so we're starting to talk about strategies for dealing with getting through it and all that sort of stuff. I'm going to throw out one random thing that really made a difference for me. That's not even high technology, especially since I spent so much time asleep or so much time in bed. Right, 20 hours a day of sleep was kind of crazy. Or I'd wake up and have a few minutes that I'd be awake, and then I'd just go back to bed. Um, one of the things that really enhanced my experience, and this is going to sound silly coming from a guy, was flannel sheets. I have, bamboo sheets that I actually usually have on my bed because they're nice and, they keep things cool. And if you're in Texas, if you want to, blah, 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 you want to do that. But the other thing that really mattered a lot was I changed my sheets to my flannel sheets because, it's been really cold over the last little bit. And those muscle aches were it was like, what's up with this? Like, it was, the worst muscle aches after, like David was saying, a really harsh workout. And a harsh workout that I didn't necessarily take care of myself after, right? So climbing into bed with flannel really made a difference. Any other suggestions, like when someone's getting through it, that from the like the collective knowledge here, just about like things that helped you get through things?
A lot of ibuprofen.
Yeah, with your family, your wife had COVID, right? And
Yeah.
lots of ibuprofen.
Lots of ibuprofen.
Yeah.
Lots of vitamins, like you were saying.
Well, actually, in my case, I'm really, really bad with the medicines, but I'm pretty sure my doctor prescribed a test, is a different name in English. So the Tylenol. What's the I don't
Yeah,
know how you call it in English.
there's ibuprofen, and then there's acetaminophen.
Yeah, that one. That's Tylenol,
yeah,
right?
that's Tylenol.
Yeah, because in Spanish it's another name. Yeah. Yeah, so that's why my doctor prescribed. I mean, I remember taking 750 milligrams from Tylenol, and if it was something really strong, I really had really bad headache, I would take 2 pills from 750. And in terms of exercise, and in terms of muscles, I just slowly started to get back my pace of working out and just walking around and things like that.
Yeah, exactly. And as you've got a couple of different things that you're putting into the chat. I want to save the stuff, the things that happened in the post you said about Illinois. I want to hold on to that for a second, but go ahead and mention what you're actually chatting about as well.
For any flu, my dad always says rest and fluids. He's a pathologist, and that for such a serious condition as COVID can be, that's even more valid. And sometimes I can experience that I don't give myself the rest that I need just because I think I can't. And I think it's important to be in tune with what the body is asking. And if the body is asking for sleep, for rest, just have it. I remember my mom, she has a health condition of multiple sclerosis that brings a lot of tiredness. And I remember growing up hearing her voice with lots of guilt saying that, oh, I am going to lay down for 15 minutes. And so just going back to Brené's research about wholehearted living, just allowing ourselves to let go of exhaustion as a status symbol and productivity as self-worth. And she recommends play and rest, but then when we're sick, right, it's just, that's rest that the body is asking for. So
Yeah, that's one of the things that came up for me. In fact, I even I tweeted about, or not tweeted, I posted on Instagram about this. I remember waking up one of those times and absolutely feeling guilty about sleeping, and it was interesting because it hit like when I realized how guilty I was feeling. Now the positive thing about it was it brought to my awareness that I've actually always felt guilty. I mean, I didn't realize that I would have how guilty I felt because it didn't occur to me that I might be driving myself in a way that that doesn't work. And so that guilt was quite interesting to see how visible and like upsetting it was. And I reflected that, as a child, I never was allowed to. My single mom, it wasn't easy to be sick, and so I never missed any school until I hit high school. Like not one day missed because of sickness until high school, which probably I was responsible for infecting all the rest of y'all with whatever I had. But it's interesting to think about like how guilt, like what Inez is mentioning, and the work that Brene Brown has done as well about that, about guilt and shame, and just how that showed up. I'm wondering, so I want to switch to a couple other things because I want to talk about like some of the other the community settings. But does anyone else have any other suggestions about how you're getting through things, how to prepare? It's definitely the type of thing that more than likely now with Omicron is what they're saying. The CDC yesterday, someone announced that they're just expecting everyone in the United States, as an example, everyone's going to get it. Like even in my case, with I just had the two Moderna shots. I hadn't had my booster yet. And that was mainly because of some other stuff that I had. I had another medical procedure that I had to get done and all that sort of stuff. And they said, hey, hold off. We don't want you to get that. They didn't want to have like interference between the two things. And I'm like, okay. And then the travel that I had, I didn't want to have like just the timing was off. But any other things before we switch kind of into more of the community conversation part of that? How to prep, how to be prepared for it, besides just food, water, all the different things like that. Jello, did you want to say something as well?
Hey everyone. Yep. So I was not planning on speaking today, but I'm just gonna probably share some of my experience. So being a nurse myself, we probably make the worst patients. So I never got sick all throughout the pandemic, just this one. So it's fairly new to me. I thought I knew a lot of things about COVID already, but I think I got Omicron as well. So while David was sharing and Kevin was also sharing about some of the symptoms, I could really relate. Like for me, I could not even consider it mild. But just for context, here where I'm from in the Philippines, our healthcare system could be a lot better, I think. So we don't usually have the access as some other does when it comes to healthcare. So most of it is just really the option is just stay at home, even if you feel like it's probably going moderate already. So probably that's what happened to me. There was one night I was working because I'm working at my time right now. It's going 2 a.m. And there was this one night I can really remember I had chills like I never experienced before. So and some of it I was really curious because I'm fully vaccinated as well. Um, haven't had my booster shot, but it was something really difficult for me. So then I had to go back to my medical roots and check on what can I do, what I've been missing. So it's the usual things like vitamins, water. My wife had it too, and she's also a pharmacist herself. But there was the the first few days we really felt helpless about it. Um, you would think that living in the capital here in Manila, that it would be a lot better for us, but even getting a test is really really expensive here. Um, so basically, what they advise us, if you just have symptoms, consider yourself positive, no need to test and everything. So, but um, I'm I'm at day 10 of my quarantine right now, and I think I'm a little better. But hearing what David was also sharing a while ago, I could relate to that. Um, I always tell myself I'm better now, but sometimes my body still uh, calls on me to rest a little more. I like what Ines was also sharing about feeling guilty about resting. That's also something that I struggle with sometimes. But I think lessons learned probably would be, Kevin always tells me this, just to put a lot of premium on your health. Um, and because I realize that no matter how many great ideas or skills I want to put out there, if I'm not healthy and if my body's not responding to my what I can give out, then it's probably useless. So I think that's one lesson right there. Again, being a medical person, probably sometimes you think that you're on top of it until it happens to you. So basically, that was my experience.
Yeah, well, so let's actually switch gears then into there's a in the chat there's a conversation going on about prevention, specifically about and as mentioned that she's traveling internationally, and and she's traveling internationally kind of soon, and I can share a little bit about how did I actually get through going on I don't know how many different airplanes it was with no problems at all, right? No problems at all. For me, it was an N95 mask. Now, very fashionable black N95 mask, by the way. Or these are KN95 masks, by the way. I just bought them from Amazon. I have extra packages of them, just that I just keep them in the car. Like there's and I do reuse this one some. The flights that I did on the international flights when I went to Hungary back about 4 weeks ago, 5 weeks ago, 6 weeks ago, something like that. I didn't do. I mean, I was really specific about not reusing them. I was really specific about being ultra aggressive about making sure I wore it in a certain way. I carried my own water bottle, which has this type of extension on it, and part of the reason I think that that's valuable was when I was drinking, I would drink just from this, and I kind of shield myself a whole lot because this was my travel was actually in the United States was Thanksgiving week, so I was traveling for business, but I was it kind of was one of the most busy travel times in the United States history, right? And it's interesting and I knew I'd be exposed to a bunch of different things, but I was really, really, really aggressive about that. The other thing is you can get alcohol wipes and stuff like that to use, which are valuable to sanitize something. But on my hands, I kind of thought I might actually have it here. On my hands, part of what I did, there are now nanoparticle ways of cleaning your hands, or not cleaning them, but antiviral type of solutions that you can spray on your hands that will actually keep your hands clean. Like you can put it on a surface, you can spray it on a surface, and it creates this like nanoparticle barrier that somehow is extremely disruptive to viruses. Based on what I've read, COVID's much more airborne, and we don't really have to worry about touch, but I still took the preventative step about buying this stuff anyway, just because I was like, okay, I don't want to take any chance that, that somehow I inadvertently touch the surface of the airplane and then touch my face somehow and blah, blah, blah. I also think I have, really good awareness of when I'm about to touch my face, just because of all the martial arts training, like, to feel like, oh, wait, my hand's coming close to my head, even my own hand. But that's something that, even they showed, Dr. Fauci was, like as he was presenting, telling people all this preventative stuff. During that video, he actually touched his face a bunch of times, and it's really kind of funny. So I don't think that that's so easy to do. Those are some of my preventive stuff. Any other prevention things that we want to share as a community that might be helpful? Well, that's so Vladimir said stress management, very important. One of the things that actually helped that reminded me is I was getting through those days, and it's not like I didn't have to slog through it as many days as David did, but I did meditate. It's on those handful of times that I woke up, I meditated and I trained my body to really breathe deeply. I think that that really mattered as well. Now, obviously, I didn't have the level of pain that David is describing and that he went through without having, that was prior to the vaccine, and so he didn't have like kind of shield. But yeah, and as is mentioning, thank God there is Zazen. Both of us are students of a Zen school that's here in town. That's where I learned to meditate, and it was really, really, really helpful to have that as a practice. And it doesn't. It doesn't make sense for the person who's not meditated until you're right in the middle of like this thing where it's like hard to breathe. I was having a hard time breathing between cedar allergies and COVID, and just to be able to sit there and do this natural process of learning to breathe in the most simple kind of ways really made a big difference. I'm wondering so part of what I'd like to do is I now want to switch a little bit into what do we do about the environment this is happening in? Like, and as you just mentioned a while ago, a little bit about what happened when you're on your trip. Do you mind sharing that on one of your trips to Illinois?
Yes, I was in an elevator and two gentlemen walked in. I was wearing a mask and they were not. And as they were walking out, we just started stroke conversation. And as they were walking out, they actually held the door of the elevator so that they spend a few minutes trying to talk me out of removing the mask.
Yeah, it's really an interesting thing. This whole political discussion that's happening in the U.S. that I think is happening other places where people are actually using something that should be a health event as a political theater, right? Where they're like saying, "Hey, take off your mask. Don't you want to be free?" Or whatever the dialogue is. It is quite interesting.
What is curious also is that in that same hotel, as soon as you walk in, there is this, okay, masks are required as per governor's blah 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 mandate. And then and so it's like they're ignoring the mandate. So it's not like there is no guidance on what to do.
Yeah, no, it's quite interesting that there's stuff like that that's been happening. Where I stand from the standpoint of about looking at this politically, the thing that upsets me the most is the political leaders that are actually using using COVID to drive politics. But the worst part is the ones that are like anti-mask or anti-vaccine in their rhetoric, their political rhetoric. But then if you ask them what they really done, no one's really asking these questions. Like as an example, I'm a critic of Governor Abbott, and it's not that I'm a critic of Republican business policy, but I'm a critic of a leader who is saying, well, you shouldn't have to worry about being vaccinated. You shouldn't have to worry about having a mask. But then if you look at, in his case, he's had the triple vaccine, plus gets, what's the blood transfusions that are called, that he was getting proactive blood transfusions to give him that next layer of protection on top of that as well. And not just saying, hey, you know what? You should be free to do whatever you want to do, but hey, by the way, this is what I'm done. Part of the thing that I actually would like to be critical of is of our political leaders that aren't actually owning up to what they're doing for their own selves to take care of themselves, and they're holding that back. Any dialogue? Anyone want to say anything more, like stories like Ines just mentioned? Thoughts about this as well? How we actually can shift this in our cultural frame as well?
I just wanted to add real quickly. Well, I'm sorry, Kim. I think.
Yeah, no, go ahead, David.
Thank you. Real quick, just that I'm seeing it in both ways. I mean, one example, like Ines mentioned, But then again, I see a lot, for example, in social media, people going to the other extreme in terms of scaring people with false information. Just to give you a quick example, I saw that New York Times presented some charts about infections versus, I think it was deaths in New York City. But the last slide was actually showing about how I think 90-something% were not vaccinated. And then I saw that same first chart about how the deaths were actually rising in New York City, and saw and some doctor here in Mexico just tweeted that first graph about deaths without the whole context of what is actually happening in NYC. So just a quick example, and I like that I've seen a lot in WhatsApp groups and things that are shared from both sides. People telling you like, hey, it's nothing. Continue to do your life. Don't wear a mask. Don't get vaccinated like that. And at the same time, people going to the other extreme.
Like there's definitely problems happening on both ends of the spectrum. It's not just one-sided. It's like there. It's like, yes, we should be cautious, and also there's caution required, and then also let's not drive people too crazy on the other side.
I mean, the other example was I don't know if there was a lot of noise about this in the US about I think they call it Delta Cron. The supposedly Delta Omicron that they were mutating together as a new variant. I don't know, you heard about this?
Deltacron, yeah.
Yeah, I know. I haven't heard anything about that.
Supposedly there's this new quote unquote variant where Delta and Omicron are together, and it was
so it's really infectious and really devastating.
Yeah, but then new studies started to show that it was just a contaminated. It was am I saying this correctly? A contaminated lab test.
Yeah.
Yeah. So I mean, but the news started to spread all over the world. There's new dangerous variant that joining both deadly and contagious, and so.
Well, good. Well, so I mean, today's conversation is kind of, especially I think because I'm kind of slow. It's like it's slow but insightful, right? There's like a lot of things that we can actually do and stuff like that. It's interesting to go over and hear all of your experiences, how you've been dealing with this, what you're doing to prepare, or the different preparation things, how to prevent this, and then the context, the community context that we're seeing as we're talking about this. Part of what happened last week is I mentioned during the program and before and after as well is that this week we were going to plan out a bunch of things and tell you what's going to happen over the next few weeks. None of that planning happened. I see Melvin smiling because he knows that I was like saying, it's going to be great. It's going to be great. We're going to have this whole quarter of venture outfitter programs coming out and all that sort of stuff. And it's probably going to take another couple of weeks. So we'll have this next week on a program. More than likely, we'll do another community conversation because there's some catching up that we need to do, especially with some of our colleagues that are actually from in different programs around the Tech Ranch. We'll be following up with the Hungarian group again, and we'll do part of that during this session. That being said, it'll be valuable for anyone that might want to just that's moving their venture forward. Part of the thing will be picking that back up. I really don't know how to close up the conversation about COVID other than to say, yeah, that kind of sucked, and I kind of wish I had that week back. And don't get it if you can. I think it actually would be much better to just totally avoid it. I hadn't really thought about it, but as I look back at that one meetup that I went to, that I'm pretty sure was the super spreader event that I got it, that closed in space. It was a physically closed in space. A lot of people packed together. Very networking event. It wasn't necessarily a good location. It wasn't necessarily any kind of prevention measures, and I didn't wear a mask. So shame on me because I knew better. That being said, over the coming weeks, we'll work on this. I'd like to actually make sure that if they're just switching gears really quick before I do like the closing slides and stuff like that. Anyone have anything that they want to talk about their venture? Ines would send me a note and I'm really excited to have her on the program, and hopefully she'll be in the community and stuff like that. She's in the process of working on um, uh, social impact entrepreneurship as well as venture entrepreneur. I would be getting involved in a venture firm. Ines, any requests you want to make to the group, or tell us a little bit more about what you're looking for, what you'd like to plug into?
Yes, my goal is to become an investor who is helpful to the companies that I invest in. So I am looking for an opportunity to actually work in a job that will help me build the skills of an investor, particularly in the impact innovation space.
That
Are you currently looking to invest and deploy any capital?
No,
for it?
I am building the nest egg to invest.
Okay. What kind of businesses or what kind of industry are you interested in, getting involved in or applying your support?
For me, the social or environmental impact is more important than the industry itself.
Okay.
I'm very comfortable with technology, healthy living, healthy food,
Okay.
but I'm not restricted to those particular industries.
Okay, great. Maybe we could follow up and talk about some scenarios that I'm looking at.
Yeah, definitely. That so Omar is one of our venture partners at Tech Ranch and manages a lot of the investment conversations. Since my background is innovation, I don't, I have a lot of insight about investment, but I don't really feel like, yeah, I mean, I think I have much more of a background in this other area, so I kind of tend to say other people know more about investment. That being said, this ties into something that just happened in the chat session. David Nichols just asked about the TR Slack channels. Ines and David, make sure that Jello has your email addresses right now. And part of the thing to do is he'll invite you into the Slack channels. We have a Mighty Network and we have some Slack channels that we're experimenting with. It seems like historically the Slack channels have gotten a lot more exercise than the Mighty Network has, and I know that I'm kind of still attached to the Slack channels myself. That's one of the reasons that we didn't just fully switch over. But if you'll make sure that, and as one of the things you can do is post a request out into the request channel that David was just asking about. And David, yeah, the best thing to do is instead of asking me to do it, let's just make sure that we actually get get you into that Slack channels as well. And Jello can do that. I'm gonna go ahead and do this just because it's been a very, very light day and I'm low energy, and that's probably not going to change anytime today. But part of what we'll do is on the following things too. Make sure that if anyone is not on our email list that wants to be on our email list or our mentor list or our country manager list, or I think we have several other things there, make sure you go to this web page at techranch.com/connect, and there's a whole different litany of different things you can sign up for. We're going to be adding a few other, and this URL is not really a public I mean, it's a public facing URL, but it's more for the people that already know about Tech Ranch, already know about Venture Outfitter, and want to take advantage of just plugging in. And so, and if there is anything else that you need, part of what we can do as well is follow up with us. That being said, these days, if you have something that you want from me, I always ask that you also copy Jello on it. And Jello's email address is ea@techranchaustin.com. That stands for Executive Assistant at techranchaustin.com. And he can get you, he can kind of be your inside man about getting things on. One of the other things and yeah, he just posted that. Part of what we'll do is I'm going to go ahead and close out today in a very low energy kind of way. And it really feels weird. I feel guilty, by the way, about being low energy. It's really kind of a weird feeling. You know, and I don't think it's just because I had a couple of drinks last night, but oh well. You know, shame on that. I'm not going to do that for a while. Now that I know that, I'm like, okay, it affects you more than you really would have expected to. But it's always an honor to be here with y'all, and be a part of a community of entrepreneurs that are driven by vision and values. Let's go change the world for the better together. Let's go make a difference in the world. Let us know what you need from that, and we'll get you onto the network, and we'll go from there. And with that, we'll officially stop the recording.